Do you think about having a baby? This is something that many people with HIV consider, and your healthcare team wants to help. We would like to help you have a healthy and safe pregnancy. Even if you're not thinking of having a baby right now, we would like to share some information with you about how women living with HIV can plan and prepare for a healthy pregnancy. Preparing and planning for a healthy pregnancy is called preconception care. This involves helping you get as healthy as possible before you are pregnant and adjusting your care and treatment in ways that help protect you and your baby. It's important to know that pregnancy does not make HIV worse. Women with HIV can have healthy pregnancies, but women who are sicker from HIV, like those with lower CD4 cells or active infection, might have more pregnancy complications. To make sure you have the healthiest pregnancy possible, it's important that your HIV is well controlled. This is done through taking HIV medicine, or ART, antiretroviral therapy. Your HIV viral load, or the amount of virus in your blood, should be suppressed, or less than 40. And ideally, your CD4 count, or immune cells, are 350 or higher before getting pregnant. Both of these things happen by taking your HIV medicine every day. A mother with HIV can pass the infection to her baby. This is called perinatal transmission. Your HIV medicine helps lower the risk of passing the virus to the baby. The medications for HIV are not likely to harm your baby. By taking your medicine exactly as prescribed and having a suppressed viral load, the risk of your baby getting HIV is as little as 2 in 100, or 2%. When a baby does get HIV from their mother, it is usually near the end of pregnancy, at delivery, or during breastfeeding. Because HIV can be passed through breast milk, breastfeeding is not recommended. By taking HIV medicine all through pregnancy and seeing your doctors for HIV and prenatal care, you can have a suppressed viral load at delivery. If your viral load is less than 1,000 when it is time for the baby to be born, you can have a vaginal delivery. Before you and your partner try to get pregnant, it's important that you're both screened and treated for sexually transmitted diseases. Being free of sexually transmitted diseases reduces the chance of passing HIV between you and your partner. If your partner has HIV and has a suppressed viral load while using HIV medicine, it is okay to have sex without a condom during your fertile period, which means the couple of days in your cycle that you're most likely to get pregnant. It's very important to use a condom the rest of the time. We will go over this method more shortly. If your partner doesn't have HIV, there are things that can be done to help prevent passing HIV to him. Many women with HIV worry about this when thinking about getting pregnant. While pregnancy can increase the risk of passing HIV to an uninfected partner, using condoms and taking HIV medicine greatly reduce the risk. At this point, we don't have options for getting pregnant that completely prevent passing on HIV, but there are several ways that can very significantly reduce the chance of transmission. Another way to reduce transmission is PrEP, or pre-exposure prophylaxis. This involves treating the HIV-negative man with HIV medicine during the time they are trying to get pregnant. Taking this medicine every day prevents getting HIV. One way to get pregnant without exposing your partner is through vaginal insemination, or some people call it the turkey baster method. This is when semen is collected from the man into a condom or cup, and then, using a syringe without a needle, the semen is taken from the condom or cup and gently placed inside the woman's vagina. This is usually done at home. Some couples elect to have unprotected intercourse or sex during the fertile period. If this method is chosen, it's very important for your viral load to be suppressed. Your partner can also use PrEP to further decrease the risk of passing HIV to him. Some couples choose to have semen checked by a doctor before trying to get pregnant to make sure the male partner himself is fertile. This can reduce unnecessary exposures to HIV. So how exactly does this method work? It means a couple would use condoms every time they have sex, except on the days of a woman's cycle when she's most likely to get pregnant. A woman's menstrual cycle is usually 28 days long. You are most fertile during the time of ovulation. Ovulation usually occurs 2 weeks before the first day of your next period. Using a calendar, you can write down the first day of the menstrual cycle, or the day you get your period. This is called Condom Day 1. Then count ahead and mark fertile days 10 through 16. These are the days that a woman is most likely to get pregnant. This assumes the woman has a 28-day cycle. So these days, 10 through 16, would be the only days a couple may choose to not use a condom during sex or use the turkey baster method in order to get pregnant. There is a risk of passing HIV if you do not use a condom, but having a suppressed viral load and your partner being on PrEP very significantly reduces the risk. During all of the times of the month, couples should use condoms 100% of the time. If the time between your periods change each month, or it's longer than 28 days, you can talk to your provider about ways to determine when you're fertile or most likely to get pregnant. An ovulation predictor kit is one option your provider may recommend. This is a urine test done at home to tell you when your body is fertile. There are certain things every woman should do when preparing to get pregnant. It's recommended that you take a vitamin with 400 micrograms of folic acid every day. This helps prevent certain birth defects in the baby. You should avoid over-the-counter medications or herbal supplements. Also, your healthcare provider may need to update some vaccines. Make sure you are getting regular exercise, eating a healthy, balanced diet, and are at a healthy weight. If you smoke cigarettes, use any drugs, including marijuana, or drink alcohol, now is the time to stop. If you need help stopping, let your healthcare provider know. Only you know when the right time to have a baby is for you and your family. We hope to help you in this process by giving you the knowledge you need to do it safely and confidently. If you have any questions about HIV, birth control, condoms, sex, getting pregnant, or pregnancy, please ask your healthcare provider. We are here to help.